To measure ulnar deviation, have the patient sit with their arm pronated on a table in neutral position. Center the axis of the goniometer over the capitate with the stationary arm along the midline of the forearm. Have the patient ulnar deviate. Adjust the movable arm parallel to the longitudinal axis of the third metacarpophalangeal shaft. This patient measures at 56 degrees ulnar deviation. Average range of motion is 30 degrees. To measure radial deviation, start in the same position as ulnar deviation, with the axis of the goniometer centered over the capitate and the stationary arm along the forearm midline. Have the patient radial deviate. Adjust the movable arm of the goniometer to be parallel to the longitudinal axis of the third metacarpal phalangeal shaft. This patient measures at 26 degrees radial deviation. Average range of motion is 20 degrees. To measure metacarpal phalangeal joint flexion, have the patient sitting with their arm on a table in anatomical position. Place the axis of the goniometer on the posterior aspect of the metacarpal phalangeal joint, with the stationary arm parallel to the longitudinal axis of the metacarpal. Have the patient make a fist. Adjust the movable arm of the goniometer so that it is parallel to the longitudinal axis of the proximal phalanx. This patient measures at 90 degrees metacarpal phalangeal flexion, which is the average range of motion. To measure metacarpal phalangeal joint extension, start in the same position as metacarpal phalangeal flexion. Place the axis of the goniometer on the anterior aspect of the metacarpal phalangeal joint, with the stationary arm again parallel to the longitudinal axis of the metacarpal. Have the patient extend their fingers. Adjust the movable arm of the goniometer so that it is parallel to the longitudinal axis of the proximal phalanx. This patient measures at 10 degrees of extension. Average range of motion is 45 degrees. Compensation for a lack of range of motion in the distal arm is demonstrated by using extra motion at the elbow and shoulder, predisposing to several pathologies such as a fracture, scapholunate instability, carpal dislocation, or carpal tunnel syndrome. Limited grip strength also could result from a lack of range of motion and cause problems with daily living activities.
Extend your hip. Adduction now. Externally rotate. Now extend the knee. Plantar flex your foot. Invert the foot. Now flex your toes. And do it again. Now flex your hip. Adduction now. Internally rotate. Now flex the knee. Dorsiflex your foot. Evert the foot. Extend your toes. And do it again. And do it again. The subscapularis does internal rotation. To test for this for grade 0 to 2, the patient is seated with the elbow flexed at 90. The clinician supports the patient's arms as they move into internal rotation. For grade 0, there is no contraction. For grade 1, there's a palpable contraction, but the subscapularis is too deep to palpate. In grade 2, the patient moves through the motion with the support of the clinician. For grades 3 to 5, the patient is prone with the shoulder abducted at 90 degrees and the elbow flexed 90 degrees with the towel under the humerus to support the arm. The clinician stabilizes at the humerus to prevent shoulder adduction. The resistance hand is at the distal forearm towards the wrist. The patient moves into internal rotation. For grade 3, the patient just does the motion. For grade 4, the patient does it against moderate resistance, and for grade 5, it does it against maximal resistance, or a break test, which is holding the position of internal rotation for 3 holds, for a 3-hold count.
The infraspinatus and teres minor perform external rotation. To test grades 0 through 2, the patient is sitting, the arm at the side with the shoulder adducted in a neutral rotation, and the elbow is flexed to 90. With the forearm in mid position, the therapist stabilizes the humerus. The patient externally rotates the shoulder by moving the hand away from the body. Grade 0 is no palpation, no contraction, no movement. Grade 1 is you feel palpation, but the teres minor is too deep to palpate. There is no movement with grade 1. Grade 2, the patient can move through the motion. To test grades 3 through 5, the patient is prone, shoulder is abducted to 90, elbow flexed to 90, and arm proximal to elbow is resting on the plinth. The therapist stabilizes the humerus to prevent shoulder adduction. The patient externally rotates the shoulder by moving the dorsum of the hand toward the ceiling. To do a break test to differentiate between grades 4 and 5, the patient will resist the clinician doing shoulder internal rotation. The clinician applies the resistance to the distal forearm.
The supraspinatus does abduction at 90 degrees. To test grade 0 to 2, the patient is supine with the arm at the side in a neutral position and the elbow is extended. The clinician supports the weight of the arm while stabilizing the scapula with the other hand. The patient abducts the arm to 90 degrees. For grade 0, there is no palpation or contraction. For grade 1, there is a palpable contraction, but the supraspinatus is too deep to palpate. For grade 2, the patient can perform the action. For grades 3 to 5, the patient is sitting with the arm at the side and the rotation of the shoulder in neutral and the elbow is extended. The clinician stabilizes the scapula and the resistance is at the distal part to the elbow joint. For grade 3, the patient just does the motion against resistance. For grades 4 is against moderate resistance. For grade 5 is against maximal resistance. You can also perform a break test by holding for 3 holds.
Return to play criteria for a grade 2 rotator cuff strain. Return to full range of motion. Athlete should be tested bilaterally. Average range of motion for internal rotation is 70 degrees. Average range of motion for external rotation is 90 degrees. And 90 to 120 degrees for shoulder abduction. The athlete should be free of pain and should score a 5 on all manual muscle tests for the rotator cuff muscles. Give me a slider. Give me a knuckleball.
Give me a change up.